Hello, this is Falah. Today I will be happy to present on heart disease or cardiovascular disease. Heart disease is the first leading cause of the death in the United States. More than 600,000 Americans die of the heart disease. This is one of every four deaths in the country according to the CDC. Today I will show you what is the heart disease signs, symptoms, risk factor in addition to the morbidity and mortality rate. Also in primary, secondary, and tertiary prevention, public health effort to decrease the heart disease literature review and conclusion. American Heart Association defined heart disease as a condition that involves narrowed or blocked blood vessels that can lead to the heart attack, chest pain, or stroke. Other conditions that affect heart muscles, such as valves, rhythms. Most common types of the heart disease include heart attack, heart failure, arrhythmia, heart valve problem. Heart disease symptoms might be different in men than women, but in general include chest pain, chest tightness, chest pressure and angina, shortness of breath, pain and numbness, weakness or coldness in the legs or arms, uh, pain in the neck, jaw, throat, and shoulder. Risk factor of the heart disease that can be changed include smoking, poor diet, diabetes, physical inactivity, obesity, stress, poor hygiene, high blood pressure, high cholesterol. While the risk factor can't be changed include age, family history of the heart disease. According to the CDC data, morbidity of the adult in the USA with diagnosed heart disease 28 million, which represents 11.05%. Number of the visits to the physician office with the heart disease, it's 15.5 million. Mortality of the heart disease, 635,000 people die in the US in 2017. 196 individual days per 100,000 population every year, which is the first leading cause of the death. Primary prevention could be treated with a healthy lifestyle choice. Knowledge is power. Know your risk factor of the heart disease. Physical activity, control blood pressure, control cholesterol, keep healthy weight, prevent diabetes, enjoy living free smoking. Secondary prevention include lifestyle change, medical care, modification of the behavior risk factor, psychosocial care, education, and support for the self-management and adherence to the prescribed medicine. Tertiary prevention includes surgical procedure, cardiac rehabilitation, surgical procedure to help restore blood flow to the heart, while the cardiac rehabilitation include maintain or improve both physiologic and psychosocial outcome, and finally quality of the life in the patient through a combination of exercise, education, and psychological support. Now let's talk about the public health impact of the heart disease. Public health work to develop policy to reduce risk factor of the heart disease and ensure effective public health action, and also implement intervention program in the timely manner and on the sufficient. Public health create opportunity for training, offer model standard for preventing heart disease, also make consultation and technical support continuously available to the public health agency, including their laboratory. Public health also develop innovative ways to monitor and evaluate policies and programs. American Heart Association uses several approaches to improve heart disease, include effort targeted to the general population as well as to the individual at risk for the heart problem, data and disability, effective identification, treatment, and management for those with the existing heart disease to prevent additional effects of the disease and maintain quality of their life. Finally, public health educate about the cardiovascular health intervention in the multiple setting for the all age groups, especially those in high risk, strengthen public health agency to assure that they develop and maintain sufficient capacities and competence. In this peer-reviewed article, Neighborhood Environmental Health and Premature Death from the Cardiovascular Disease Eligibility Units for this study were 124 Tennessee Shrug in Atlanta. Dates rate were obtained from the Georgia Department of Public Health. The main study outcomes were mortality rate at the sinus tract level and among weight and non-weight residents. In this article, they used cross-sectional ecological method, which is type of quantitative research method. They found improved food access and vocal ability were associated with a reduced overall premature cardiovascular mortality. Also, they found sufficient racial difference between white and non. All of the study methods, cross-sectional ecological design was so important in examining relationship between the food access, workability neighborhood, and heart disease. Eligibility participant age 35 to 64 years between 2010 to 2000. In conclusion, you can help prevent many types of the heart disease by making lifestyle change, quiet smoking, control over high blood pressure, high cholesterol, diabetes, exercise at least 30 minutes. In addition to that, diet and lifestyle change, eat diet that's low in salt and saturated fat, maintain healthy weight, reduce and manage stress, take medication as prescribed, make diagnosis surgery and cardiac rehabilitation. Finally, heart is the machine for the life. Save it by keeping away from smoking. Be active. reference is in the note below. Thank you for listening.